Thanks so much for having me speak here. I'm happy to go through kind of a quick crash course in endocrinology and some of the side effects that we're starting to see. So I think, one of the questions is why is this relevant to this talk? Because just, a handful of years ago, we probably wouldn't be talking about endocrine conditions at a melanoma conference. And it's like Dr. Wang said, the new treatments that we're seeing, particularly the immunotherapy, tends to trigger these effects. And it's not that surprising because we know that endocrine organs are very prone to develop these kind of autoimmune attacks. If you look at populations in general, particularly thyroid, which is the most common endocrine issue we see with immunotherapy, antibodies against the thyroid when they do population studies in the US are present in up to 39% of the population. So a lot of people have some degree of latent autoimmunity against the thyroid or other endocrine organs that we can trigger with these medications. And you can see that as levothyroxine or thyroid hormone is one of the most prescribed medications in the whole country. It depends who's doing the counting, if it's somewhere between 1 and 3, but it's definitely up there. It's important in the short term because acute loss of some of these hormones can be life-threatening. And so we need to know about these conditions. People who use these medications need to know about them. Patients need to know about them. So if these symptoms develop, they can get the treatment they need quickly. And we're talking about it here at a survivorship conference because inflammation to endocrine organs tends to induce permanent damage. So as opposed to the colitis or pneumonitis, where you get a course of prednisone, the inflammation goes down. With endocrine organs, a lot of the time, the inflammation subsides, but the glands have a poor ability to recover, so you end up deficient in those hormones long term. So a brief overview of, the endocrine system is what the term we use for really a collection of organs, everything from organs in the brain to glands scattered throughout the body. And what the unifying feature of them is that they release things we call hormones. And hormones are basically any kind of protein or chemical the body makes that travels through the bloodstream and then has an effect on tissues somewhere else in the body. And the key factor of these is that they're not just released constantly or in an unregulated fashion. There has to be a trigger or a regulation of their release. So it's either controlled by another organ or the organs are sensing something in the body and then releasing a hormone to compensate for it. And you have to take all those things into account when you're designing the treatments and the treatment plans for these conditions. So if a gland is damaged, the hormone levels drop, and we treat the deficiencies by replacing the hormones that are missing. So, like I said, the most common is the thyroid, and the thyroid gland is regulated through the pituitary, which is common to a lot of the endocrine organs. So the thyroid releases two hormones, T3 and T4. It's showing up. T3 and T4, which are the active hormones in the body. They work to regulate the body's overall metabolism. So if you have too much of them, they call that hyperthyroidism. If you have too little, you have hypothyroidism. These travel through the bloodstream, have their effects on the body, and then they're sensed by the brain, part of the brain called the hypothalamus, which sends a signal down to the pituitary, and that lets your body regulate. If they think there's not enough thyroid hormone in the body, it releases more of this TSH, thyroid stimulating hormone, that stimulates the thyroid to release more. So we can look at levels of all of these hormones to get a sense of exactly what's going on with the body. Is it sensing these hormones properly? Is it stimulating these hormones properly? And adjust treatment based on that. So what we see the most commonly with immunotherapy is a very aggressive form of thyroiditis, which is inflammation and damage to the thyroid gland. And so you can see that here. This is a PET scan of a patient. So this is up the front of their neck. This is the back of their head. This is part of the spine. And you can see here that the thyroid gland is picking up a lot of the tracer that they use for the PET scan, which is a sign that that's metabolically active and inflamed. And this patient didn't actually have any abnormalities in his thyroid yet. In the lab work we saw, they developed later. So you can see the inflammation can start pretty early, and then you start seeing the hormonal effects down the road a little bit. So what we typically see is people have, a transient hyperthyroid phase because those thyroid cells are breaking down, releasing a whole bunch of hormone. So that makes the TSH high. The brain senses that, makes the T4 high. The brain senses that, tries to drop the TSH level. This leads to kind of a rev up in your metabolism. So people have a fast heart rate, palpitations, can lose some weight, feel too hot. But that tends to go away pretty quickly on its own because that thyroid is damaged, it's not making the hormone anymore, so it progresses down to the opposite, hypothyroidism, where you get the opposite pattern in your labs, and you get a slower heart rate, more weight gain, and feeling too cold. So the treatment for this is to replace the hormone that's missing. The pituitary gland, controls multiple endocrine organs, and it does this through a feedback loop where if it's not sensing enough, it will release more of those stimulating hormones to enhance the amount of hormone those tissues are making out in the periphery. So without being able to release those stimulating hormones, those glands might be, structurally intact, but they just can't function. So this usually shows up with headache, fatigue, and nausea. And the most critical is the lack of function of the adrenal glands, because that can be life-threatening. They can give, high doses of prednisone and things, which can help bring down the swelling. You can see this gland is usually just the size of a pea, so this is really swollen and pressing on everything. But it doesn't really affect the recovery too much. So the treatment for this is replacing the missing hormones, the thyroid, cortisol, sometimes testosterone or estrogen, and then monitoring to see if there's some recovery. And you can have some recovery of the pituitary, but the adrenal glands are the least likely to recover, so a lot of people end up with permanent adrenal insufficiency, which is a low cortisol. Cortisol is sometimes called the stress hormone. This causes fatigue and low blood pressure and nausea. And if you're completely out and you get sick, that can be life-threatening. So the treatment for this is low doses of replacement steroids like hydrocortisone or prednisone. The body naturally tends to make more cortisol during acute illness, so people need to compensate for that. So we usually say if you get sick, you need a higher dose for a few days to help your body cope. And then if you're critically ill, if you get in a car accident or you have a bad infection or have surgery, you need much higher stress doses. So that's why we usually recommend these people wear a medical alert bracelet in case they're in a car accident or something. They can get the care that they need. Diabetes is one of the most significant conditions we see and one of the most difficult to treat. And that's related to cells in the pancreas that release insulin that regulate your blood sugar levels. And so the pancreas is part of your GI tract, and really only a tiny percent of it, only about 1%, is made up of these endocrine cells. The rest of it is devoted to making gastric juices and things. So they look like little islands under the microscope, so they're called the islets of Langerhans, and the main cells within those are the beta cells. The beta cells aren't regulated by the pituitary. Instead, they sense glucose directly and then release a proportional amount of insulin that sends signals to the rest of the body to pick up that glucose and put it into the cells. The reason that this is so difficult to manage is that you really typically only have a tiny amount of sugar in your bloodstream at any given time. Somebody without diabetes with a normal blood sugar has about 4 grams or 1 teaspoon of glucose in your entire bloodstream spread out. And for comparison, a 20-ounce Coke has 60 grams of high fructose corn syrup. About 30 grams of that are glucose. So you can see it's many times what your body has naturally. I looked up, unfortunately, Einstein Brothers bagel has somewhere between 50 and 60 grams of carbohydrates, so over 10 times the amount your body would have naturally. So you need a mechanism to put that glucose away into cells. And insulin is that mechanism, and if those cells are damaged, you just can't release it anymore. So the effects of this in the short term, high blood sugars cause issues, dehydration, more risk of infection, blurry vision, and then the most critical, when you're completely out of insulin and get sick from it, you can develop diabetic ketoacidosis, where your body starts breaking down proteins and fats because it just can't use the glucose anymore, and that causes an acidity of the blood, which can be life-threatening. And then hypoglycemia, which is from too much insulin, can induce a low blood sugar. Long term, when diabetes is managed, the degree of control becomes important because we start thinking about increased risk of heart disease, nerve damage, kidney damage, and those can all be screened for and prevented by getting the blood sugars under good control. So with this form of diabetes, which is like type 1 diabetes, since there's no insulin, the main treatment is just replacing the insulin. So the way the body makes insulin naturally, it puts out some all the time and then puts out little spikes for all the food that you eat. And we try to recreate that the best we can with shots of short and long-acting insulin, or by using insulin pump devices to infuse insulin all the time. In addition to this, there's a lot of education involved in learning about carbohydrates or counting your own carbohydrates, and then using sensors to monitor your blood glucose constantly, which can be very helpful. And then briefly to touch on targeted therapies, this is a little less of a key issue in endocrinology, but we do see some effect because these drugs do interfere with cell growth pathways, and that kind of ties into the function of insulin. So you do actually see some high blood sugars with these medications at pretty high rates, 50% with dabrafenib alone, and dabrafenib and trametinib up to 67%. But this tends to be pretty mild effect, and usually is reversible, unlike the other things, once you stop the medication. The best treatment in most cases is actually non-insulin, because insulin is already being interfered with by the medication. So some of the more general medications we use for type 2 diabetes tend to be more effective. So that's all I have for my quick overview, but happy to take questions in a little bit.